Continuing Mobile Education for Emergency Medical Services Providers. Episode 3, His Medication Makes Him Like This, Medications and Altered Mental Status. Participants will understand the impact of medications on a patient's mental status and will identify the most common medications that can cause altered mental status.
One of the cases I will never forget is a 77-year-old woman who was on an H2 blocker. She was on normal dose for healthy adults, but an elevated dose for somebody who was elderly and who had some renal impairment. And she had stripped off all of her clothing and was running down the hall of the hospital singing "I'm a Little Teapot" while pouring ice cream on her head. And it was all related to her having too much of her H2 blocker. It was something that really could have been corrected easily, but it was something that really sticks with me.
Yeah, we always are concerned that older adults in general have a higher susceptibility to changes based upon medication. So it's not uncommon that a change that may not have occurred with younger patients may be very easily precipitated just based on changing medications and causing altered mental status in an older adult. And there's probably a variety of reasons for this. I mean, we certainly know that drug metabolism changes in older patients, the distribution, elimination of some of these medications changes, so the medications can hang around in the system a little bit longer, as well as just a tolerance of even what we would think about as appropriate starting doses of medications in younger patients. We may have to go at a lower dose with older patients and go more slowly in terms of the increases in subsequent doses of the medication. So there's a tremendously more or greater sensitivity to some of these medications, and so that's where we have to be concerned about, particularly the side effects and some of the profiles of these medications and how they're going to affect that individual. And oftentimes it may be that it's very well intentioned that some of these medications are started, but maybe the patient could only be a few days into starting a new medication when we suddenly see some of these side effects.
As I just mentioned, as we get older, our blood-brain barrier integrity decreases, and things will tend to float across a little bit easier. Besides that, as we get older, some of our metabolic systems tend not to work as well. So our benzodiazepines are going to have a much longer half-life, causing that decrease in mental status just because they're sticking around longer. Some things that may be a little bit more protein-bound are going to have much greater free concentrations, which again could lead to greater free concentration, greater concentration in the brain, altered mental status.
Reasons why older adults are susceptible to adverse drug reactions include decreased drug metabolism, changes in drug distribution, decreased drug elimination, and increased blood-brain barrier permeability, as well as increased free amounts of the medication.
Altered mental status has a very, very broad differential. There's lots of things. We often have AEIOU tips and other things that we use to try to determine what the cause of that is. If you don't look at what medications they're on and or what medical history they have, you're ignoring your best source of information as to the cause of that altered mental status, and therefore probably the easiest way to rectify that altered mental status.
I think some of the most common over-the-counter medications for sure are going to be our antihistamines, our anticholinergics. We see our older person who takes some Benadryl because they have a hard time sleeping, and they'll definitely present with altered mental status. Some of the antibiotics that tend to penetrate blood-brain barrier relatively easy, fluoroquinolones for example, can cause some mental status effects in elderly patients. Any of the anticholinergics besides the antihistamines, some of the anti-nausea meds can cause mental status changes, and a lot of the muscle relaxants, benzodiazepines, narcotics. As people get older, they tend to have a little bit less integrity in their blood-brain barrier, and things tend to get across a bit easier.
I think we've all encountered altered mental status as a result of medications. More commonly, the hypoglycemic agents, so metformin, glyburide, and so forth. But also, I think some of the psychotropic medications, as well as obviously any type of narcotics, so fentanyl patches, codeine, Percocets, and so forth.
This is a common situation when we talk about altered mental status, and oftentimes it can be an acute onset of confusion or what we call delirium. And what I think about in these situations is really medications that would be most concerning to precipitate a change like this. And those would be things like medications that have side effects that are anticholinergic. So these are medications such as diphenhydramine or the trade name of Benadryl. Some of the other medications that are used for some incontinence problems. Those types of medications can have a very serious impact on a patient's ability to think clearly and can precipitate that confusion. The other thing that we have to be concerned about is could there be inappropriate usage or even an overdosage situation of commonly prescribed medications. So this may be some of the pain medications, but the patient may have been in uncontrolled pain and be taking additional doses of that may have precipitated a change. It could be simple things like some of the medications for depression or for cardiac diseases that at high doses are then going to begin to cause a problem. But oftentimes what's important to think about is that medications play a significant role in terms of a change in a person's mental status. So we need to really be able to think clearly, is there a change in medication? Or is there a new medication? Has the patient suddenly changed their strategy in taking the medications? And be able to assess that in addition to a change in the clinical condition overall. But it's certainly a concern, and I think one of those areas that for EMS personnel and the other care providers that we spend a lot of time thinking about. The medications could be certainly a major concern or issue that precipitated a change.
Altered mental status common culprits include histamine blockers, sedatives, anticholinergic drugs, and pain medications.
I think the first step is really in the assessment of the patient to really establish, is this an acute change in mental status? And oftentimes you may have to obtain additional collateral information from other individuals that are present in the home environment. So this may be family or other caregivers, to establish the fact that this has been an acute onset of change in their thinking or their mental status. And get a sense of what has changed, what's been different for this individual. And this may be, again, getting back to some of the medication strategies of what types of medications are the patient currently taking or supposed to be taking, and is there been a change where maybe that they're taking too much or that they've missed doses of medications that may be able to clue you into exactly what is occurring or what precipitated this acute change in mental status.
To better evaluate if the altered mental status change is caused by medication, establish if the alteration is acute, define the change, and evaluate the medication history for potential pharmaceutical causes. After finishing this episode, you should understand the impact of medications on a patient's mental status, as well as identify the most common medications which can cause altered mental status.